I know you have used 24-hour fasting with patients. I know you have used 3-day fasts, and you have also shared in previous conversations some very powerful statistics. One in particular, I remember on a 7-day fast, you shared a statistic, a bit of research from Boston in terms of what that does to your lifetime cancer risk. So maybe you could talk about some of these longer fasts, and then practically, how do people start going about that?
Yes. So absolutely. So at all times, they are supposed to take their blood pressures twice a day. Make sure that the blood pressure is not going down because I do not stop the blood pressure medications right off the bat. So on the blood pressure medication reduction will be done depending on your blood pressure readings. As far as blood sugar is concerned, if they are on oral agents, I'll continue those oral agents while they're doing the 18-hour fast periods. Even the 24-hour fast, I'll keep them on it, and I will ask them to monitor the blood sugars. Now, continuous glucose monitoring, the little devices, I only advise those on patients who are on insulin when I'm fasting them, because I want to make sure that their insulins don't drop off. But when a patient is taking insulin and he does the 24-hour fasts, I drop the insulin levels by half first, insulin dosage by half, and I monitor the blood sugars. And then when they go beyond 24-hour fasts, I stop insulin completely. I stop it completely because I don't want them to become hypoglycemic. So oral agents, I will continue. Insulin, I will discontinue if I'm doing more than 24 hours, but I monitor the blood sugars very closely. And then that brings me to a little longer fast. Before I go to longer fast, I make them do a 36-hour fast. So I'll make them do that once a week. Once a week means that evening rolls around, skip that meal also, and then have yourself a breakfast. Treat yourself with a breakfast the next day. And that brings it to 36 hours. So I make them do at least one 36-hour fast for maybe 2 consecutive weeks. And then I'll take them to higher levels.
Can I just clarify that? So the 36-hour fast, the way you have found it most beneficial for most of your patients is what you skip one evening meal to the next evening meal. When does that fasting time? I know you can do it any way you want, but what have you found to work? Can we just clarify that?
Yeah. So the patients already are used to having only one meal a day.
Okay.
Then I'll say skip that one meal and then have the next meal when you're supposed to have them. That'll bring it to 36 hours. So for most patients these days, they're having their evening meals because it's more social. They're having it with the families. So they'll skip breakfast, they'll skip lunch. Evening comes around, they're supposed to eat. And I tell them, skip it and go and have breakfast the next day. That brings them to 36 hours.
I guess if they're already used to having one meal a day, then actually skipping that evening meal is kind of, I don't know, just go to bed early as well, sort of, it's, I like that. So what stage do you take them from this 2 meal a day, which is this, this 6-hour eating window? You do that initially for the 18-hour fast, then you take them to 24 hours, do you, with just 1 meal a day? Is that how you do it?
That's exactly how I do it. And then they're doing 1 meal a day, 5 days a week. Weekends, they're going to have 2 meals. They do that for 2 weeks. And then I say, okay, you've been doing this for 2 weeks now. You've been having only 1 meal a day. Next few weeks, 1 day a week, you're going to go to 36. And the way you're going to do it is you're going to skip that 1 meal also and then have a breakfast the next day. So that'll bring you to and I want to see how you feel. And most of them come back saying, I just missed the meal in the evening. I watched a movie and went to bed. So why am I going from 24 to 36? Because I want to get them ready for longer fasts, especially if they're tremendously overweight and they're metabolically deranged. What's the biochemical advantage between 24 and 36? By 36 hours, almost all of them will be in some degree of ketogenesis. So it's hard to know who's going to start spilling ketones at 18 hours, 24 hours, 30 or 32 hours. It's hard to know that. So when I prime them, then I'm finding that there's longer and longer periods of ketogenesis. That means they go into ketone production at 16 hours. So long as they made their dietary changes, gradually got into this, the ketogenesis phase starts a little bit sooner at about 16 hours. And the most motivated patients say that, oh, I want to know. I said, okay, if you want to know, then go to the pharmacy and pick up some keto sticks and just test your urine and tell me when you started spilling the ketones. So after 24-hour fast, almost all of them are spilling ketones. And when they're spilling ketones, I know what's going on with their physiology at that point. I know that they're getting the benefits of some degree of autophagy, growth hormone, BDNF production, and mitophagy. I know that's happening because they're spilling ketones. So that's another motivating thing. In the patient who's showing me the interest and the ones I really want them to, yes, give them the tool. Take this home. Check your ketones. That's what I find so fascinating. So by 36 hours, they're making the ketones. So they'll do that for a couple of weeks where they now went to 36-hour fasts once a week for 2 weeks. Now, at that point, depending on how motivated they feel and how well they are doing, now I'll go to more prolonged fasts. And my favorite fast is the 3-day water fast. And most of them, I'm telling you, greater than 95% of them, when they've graduated to this point where they've gradually gone and done all this, they're able to do the 3-day water fast with no difficulty whatsoever. And if they get cramps, then I tell them, okay, take a glass of water and put a pinch of salt in it and just down it and you'll feel better. But most of them don't because they've adapted themselves. If you go into a 3-day water fast too quickly, you're going to get more cramps, but more importantly, you're going to go through what is known as keto flu and you just feel terrible and achy and you just feel really bad. So I do it gradually. But I must make them go to a 3-day water fast. I use it in that case. I also use it in patients who are able to lose weight, but then they reach a plateau. So now they're weighing 230 pounds, and I want them to have more weight loss. So they've been doing this now for a month, and they said, look, doc, I just can't shed any more weight now. I've done everything you're saying, and I'll put them on a 3-day water fast. And lo and behold, they'll start losing weight again. So I use that in patients who've reached a plateau, going to the 3-day water fast.
Thank you for sharing that. I think something I did want to bring up today, because I know a lot of people, and again, we're all influenced by the online world or the patients that we've seen or the online world that we inhabit. And, you know, I spoke to David Sinclair, this Harvard professor who talks about aging in a very, very profound and novel way. And you know, when I put out that episode with David, a lot of people were saying, look, asking people to skip meals is very triggering for people with eating disorders. And I know eating disorders are on the rise massively all over the world, certainly here in the UK and in America. So I think we need to be careful about that. I think it's worth me just flagging that here, that potentially this advice is not for people with eating disorders. That's a sort of separate issue. Well, I'd welcome your perspective on that. But also, you know, is it possible that we take these things to extremes? I guess there would be some people, we mentioned Anna Lemke's book before, Dopamine Nation, and that we're living in a world of addicts now. And that, you know, she mentions that the smartphone is the modern day hypodermic needle, which I thought was a very provocative way, but I actually completely agree with her of talking about it. There's health, there's physical, biochemical health, but there's also this kind of emotional health and our mental well-being. Do you think, as much as you love fasting, do you think some people, they can sort of overdo it and get so addicted to kind of that feeling of fasting and actually go to an extreme which potentially could become problematic?
I think you're right. It can happen. Fortunately, I haven't seen it here with somebody. I tell them, stop now, stop. This is enough. Now you should be eating 2 meals a day. And, you know, I think that the pattern you need to settle down in is, for you, I think that 2 meals a day in a 6 or 8 hour window period may be a nice thing for you to do chronically to maintain what you've gained, the benefits that you've already gained. Then I haven't seen any patients who ignored that and continued to do the 3-day water fasts on a weekly basis or whatever, or 2 weekly basis. I haven't seen that. But you are absolutely right that there are some patients who clearly have an eating disorder and they clearly have a type of addiction, and they're going up at night and they creep downstairs and they're eating away 5 bars of chocolates and all this kinds of stuff. And those patients clearly do need help. And I will not deal with those on my own. I will supervise it, but I'll send them to a psychologist that actually specializes in addictions, because they have to really spend time with that patient about addiction behavior. And it's not just behavior about the food. There may be other issues that are actually triggering, because you see, you slide from one addiction to the other, to the other. So you can't take up this alone on its own until you also take care of the sugar and maybe the cell phone and other digital gadgets that gives you the instant gratifications. And there may even be other issues. He may be a gambler for all you know, or have other type of deviant behavior addictions. So no, you're absolutely right. So recognizing those with the biggest problems, and addiction is a huge problem, and it's becoming more known now that the addiction is to not only sugar, but it's also addicted to processed food content. Processed foods and the content of processed foods are very addictive. I think that's why you want to change the type of food that you see. You're getting rid of all the addictive substances in the food, the addictive sugar in the food, and then addictive behaviors in other aspects of your life as well. So it's really looking at the whole thing. It's a huge problem. It's a huge problem. And yes, we are an addicted nation. And that's why it's making it so easier for us to become addicted to food later on in life, because it starts at a very young age. You're already getting addicted to gadgets and instant gratification.
If you enjoyed that short clip, I think you are really going to enjoy the full conversation, which you can check out here.